right. Hello, everyone. Welcome to another edition of the Gestalt Education Show. Today, we are so excited. We're sitting down with our second chiropractic school president, and none other than close to my heart, Dr. Carl Cleveland III. So I'm a Cleveland grad. I'm from this beautiful campus here in Kansas City, and I had an amazing experience my 3.5 years here in Overland Park at Cleveland University, Kansas City. One of the best stories I have about Dr. Cleveland is well, one day I'm in the student clinic and we're treating patients, and all of a sudden here comes Dr. Cleveland. He starts taking his jacket off and unloosening his tie, and he just kind of says, "Who here wants to adjust me? Would anybody like to deliver an adjustment today?" And everybody was kind of shaking their boots, and me, I'm a little bit cocky, and I said, "Hey, yeah, let's go, come on." So sure enough, we gave him a good assessment. We palpated and adjusted him, and so just one of those memories that I'll cherish with me forever. But Dr. Cleveland, I just have to applaud you too, because the thing that I really took away from Cleveland, it's a very open area. We were allowed to dabble in just about anything we'd like, within realm, obviously, but the clinical stuff was amazing. Board scores are always out of this world at Cleveland, and it was just a great experience. So thank you for that.
Well, we're proud of you. I'm happy you remembered that day that you gave me that adjustment.
Yeah, absolutely.
I think the other thing, too, the reason we're here right now on campus is Dr. Cleveland's been generous enough to have us in his beautiful school here for the Adjust-a-thon. So for the NPI people out there, this is basically our Super Bowl weekend. This is like the most important weekend of the year for us at Motion Palpation Institute. And you have always been so gracious about embracing a dynamic model here at your school. And I can't tell you how much we appreciate that, because that's not always the most popular answer. So we're really proud of that for you. So thanks you.
Well, it's my privilege. What MPI represents is part of the core approach to chiropractic assessment and technique, as you know, and it works, and for all the right reasons. So we're honored to have you on campus.
Absolutely.
Awesome.
Well, something special as we were preparing for this podcast, 2022, 100th year of Cleveland. Right. That is amazing. So you've been educating, your family has been educating chiropractors for 100 years, Dr. Cleveland. That's such a special thing. I remember several stories that you've told us in your chiropractic history class and throughout. And so would you talk to us about 100 years?
Well, Cleveland actually started with a question, 5 words. Have you ever tried chiropractic? And sometimes I wonder how often that question has just changed lives for people who tried an allopathic approach to a condition, didn't respond, and as a last resort, sometimes after expending a life savings, turns to chiropractic and lives change. You know that. You see that in your office. For Cleveland, it started with a school teacher in Peru, Nebraska, and her name was Silva Ashworth. Silva. By age 25, Silva had born all of her 4 children. Her husband left her. She was a single parent, and she had a series of health problems. And in fact, she was given up to die. The doctors in that area said, "Miss Ashworth, go home, put your affairs in order, make out your will. We know you have small children. You're going to die in 6 months." And she went home and was preparing to arrange for the transfer of the farm. And a neighbor lady down the road says, "Well, Silva, have you ever tried chiropractic?" She'd never heard the word. It's a new chiropractor in town. His name is Eaton. He's a graduate of that college over there on the Mississippi River. And so Silva then goes, she had nothing to lose. She goes to Dr. Eaton, the chiropractor, and as the story was related to me, he proceeded with a series of toggle recoil adjustings at the 6th thoracic level. You might know neuromerically the 6th thoracic is associated with an innervation to the pancreas. In any event, and her affliction centered around that organ. And after a period of time, her blood chemistries changed, her symptoms changed, and she attributed it to chiropractic. Could have been spontaneous remission, it could have been misdiagnosis, but in any event, Silva attributed her healing experience to chiropractic adjusting. And so as a mature woman of age 35, she enrolls at the Palmer School of Chiropractic, graduates in 1910, becomes the first woman to practice chiropractic in the state of Nebraska. She organizes the state association in her living room. She was on the first board of examiners of the Nebraska Board of Chiropractic Examiners. Quite a pioneer. Wow. And to be a doctor and a woman in a profession like chiropractic in 1910.
Oh my gosh!
And it was scandalous. I can share the article that was in the Des Moines Register, where Silva would go into the Nebraska penitentiary and put her hands on the spines of inmates to adjust them, if you can imagine that. Wow. Well, her daughter Ruth worked in the office as a chiropractic assistant, and Ruth said to Mother, "Take me to the Palmer School. I want to be a chiropractor just like you." And so Mother takes daughter Ruth to Palmer, introduces her to B.J. Palmer. They were colleagues. And while Ruth was at Palmer, in a class of anatomy, she meets a fellow from Simpson College. And they fall in love. And his last name was Cleveland. That was my grandfather. So my grandmother and grandfather, they met at Palmer School in a class of anatomy. Like so many students do now.
Right.
I would imagine your classmates.
Oh,
Don't you remember
of course,
some of your classmates that have done that? And so they graduate. C.S. graduate. My grandfather, Dr. C.S. Cleveland, graduated in 1917. She then relocated with him to Webster City, Iowa, and later came back to Palmer to graduate in 1919. And after practicing in Webster City, Iowa, they moved to Kansas City, Missouri. Why? Because my grandfather was an athlete in college. He coached the baseball team at Palmer College, into decathlons, and he wanted to look at the influence of chiropractic care on performance and in fitness. Where do you go in 1920 to find groups of people that are into fitness? There was no ballet or anything like that. Well, they chose Kansas City because of the YMCA and opened their practice not far from that. And he wanted to focus on fitness and athletic performance. But in 1922, with just 3 students, started Central College of Chiropractic here in Kansas City, Missouri, the north end of the Kansas City community. And the interesting challenge was, and they founded the college, and it was founded as a not-for-profit. In fact, it's the longest enduring not-for-profit chiropractic program, because even Palmer College was for-profit at that time, as many of the other colleges were. And the challenge is this. The college started in 1922, but the Practice Act that legalized the practice of chiropractic did not come about until 1927. They were arresting our graduates. And the college was strategically positioned in a duplex, a residence in the north end of the city. And by duplex, I'm talking about there was a living unit upstairs and a living unit downstairs. And it was in a Victorian home. And my father would tell the story of what it was like to grow up in that house at a time when a knock at the door brought fear of arrest. He was told that if there's a knock, and you have to understand that this, where they lived, was the clinic, it was the classrooms. The downstairs kitchen was converted to chemistry lab. The upstairs kitchen was converted to human dissection. My father said we had to eat all our meals at restaurants because the kitchens were converted to laboratories. And so the rule at the house, if there was a knock at the door, he was to remain motionless. This was my father, until his parents could peek through the curtains of this rounded Victorian window at the front of the property to make a decision. Was this a student, prospective student? Was it a patient seeking care? Or was it an agent from the sheriff's office to arrest them for the illegal practice of medicine without license? My grandmother, Ruth, would sew coins into the lining of my father's jacket and said, "Son, if you come home," and he was like 5 or 6 years old, "if you come home from kindergarten or first grade and the house is locked, and if we're in jail, go next door, Miss Aletha will take care of you. And it's okay, you can rip open the lining to that jacket, because each one of those quarters would buy you a full meal at the restaurant at Prospect Avenue and Independence Avenue." Now think about that. How many of these students that are on campus today that are studying in the seminar that MPI is putting on, how many of them will be in this profession at that time? It was literally a knock at the door, brought fear of arrest. And the rest is history.
Is the house still standing today?
No, it's not. And if it was, I'd buy it in a heartbeat.
Oh, yeah, that would be.
It's not. Here, 15 years ago, I went past it where it was the vacant lot, but there were some stairs stepping up with a little edge to the stairs with a little fleur-de-lis at the end carved in the cement. And I thought to myself, I'm going to go back and figure out who owns that lot, and I want to at least buy those steps, and I'll put them somewhere when we have the new campus. And I got busy and then came back 10 years ago. That was all gone too. But there's a fire plug that's in the same place on the street, but I don't think I could take that.
Yeah, that might be a little tougher.
So the rest is history. We started with 3 students, and as of September 14th this year, 2021, we're 633 students. The bulk of those, about 540 or 50 of those are in the chiropractic program, and the remainder are in our College of Health Sciences programs. So.
Right.
It's amazing.
That's amazing.
So
Yeah,
it
what a
started
great
with that
history.
question.
Yeah.
Have you ever tried chiropractic?
Yeah, that's amazing. It is just a huge testament. I remember hearing these stories and stuff, and sometimes it's easy for us to forget about the struggles and the sweat and the tears that have gone into this profession. And so that's one of the things that Brent and I have in common is that we're very proud to be chiropractors.
Yeah.
In a time where maybe it's easy to say I don't want to associate with the chiropractic and the history and stuff. I think it's important to understand where it's come from and then where it's going. So that maybe is a good segue. So you kind of talked about we have students at Cleveland University in multiple different programs, the DC program, then also health sciences. So it seems like now more than ever, more and more programs are being added into these. There's ATC programs at chiropractic schools. There's all occupational therapy and stuff like that. So do you see the future of Cleveland adding more programs, taking more of an emphasis on them? Is DC still going to be the main focus?
I get that question from alumni all the time because the history of our alumni, most of them, vast majority, graduated from Cleveland Chiropractic College, and that's what's on their diploma. And Cleveland Chiropractic College still exists, and it's still educating chiropractors, still conferring degrees. But Cleveland Chiropractic College is now is part of Cleveland University, Kansas City, and its College of Chiropractic, and its College of Health Sciences. Sure. So the focus on chiropractic hasn't changed at all. In fact, I think I'm the only chiropractic college president that still teaches in class 2 hours a week in freshman, the foundations of the science and philosophy of chiropractic. That's where my focus is. The College of Health Sciences, though, started providing the undergraduate prerequisites that are required to come into chiropractic college, the sciences, the physics, the biology, and we have just expanded beyond that with some key parameters. And our College of Health Sciences programs, first of all, need to align with our institutional mission, and that is to educate health promotion providers. So it has to be health promotion focused. And in addition, there needs to be a workforce demand for it. And it needs to be programs that increase quality of life. So occupational therapy, the outcome of that is it helps people recover from injury, return to their activities of daily living, which is compatible to chiropractic thinking. Rad tech, early diagnosis. Some of our graduates are saying, well, I might want to hire those rad techs to come work in my office too. Our bachelors in exercise physiology, obviously that's a component to health, and now masters in health promotion and masters in exercise physiology. Again, components of educational experience that contribute to helping people enjoy healthier lives. So yes, we're expanding, and here's a practical reason for that, and that is Cleveland, you've been on the facility, after about 4 o'clock, except for the clinic going to 6:30, classrooms are vacant. And if we can bring in programs into the night programs, for example, utilize that space. We have a registrar's office that has the capacity to handle more than the chiropractic. The financial aid is the same. So you can see that the infrastructure is there. And what that does, by increasing the degree programs and the revenues that those students bring in, it helps us to contain the cost of chiropractic education.
Right.
So it's there's a method and a strategy, and for me, it just helps bolster the chiropractic experience at Cleveland.
What would be of the people that are in the health science program, what % of them end up going through the chiropractic program, ballpark?
Many of the people, I don't have that information at the
Right.
top of my hand, but many of the people who are in the the bachelors of human biology are coming there to get the sciences and the degree that prepares them to transition into the Doctor of Chiropractic program. It's possible. Well, if you'll walk the hallways on a typical day, you're going to see chiropractic diagnosis in one classroom, and then across the hall is algebra or English. You know what I'm talking about?
Right.
Technically, a student could come out of high school, and there's some that do, go right into Cleveland's undergraduate program, transition into the DC program, and then in a period of 6 years, graduate with a concurrent bachelor's degree and Doctor of Chiropractic degree. It saves them money, it saves them time, and it works well. And they're happy. Students are happy with that program.
Sure. Yeah, that's really awesome. And then what about when we're talking maybe about that College of Chiropractic, Dr. Cleveland? You know, you and Lynn Fay have been good friends through all this, and we've been lucky to sit down with Lynn in Los Angeles, and both got adjusted by him, which was an experience and amazing. You've always kind of had, I guess, an open thought process when it comes to Cleveland. It's been kind of dynamic as far as the education changing and shifting, and you know, being huge Motion Palpation Institute homers or fans, whatever you want to say, you've always embraced that. But it's not just about embracing MPI. I think you've been embracing everybody, really. Where did that first start, and kind of where does that think tank start?
Well, growing up in a chiropractic family, my great-grandmother, Sylva Ashworth, was a chiropractor. Her daughter, my grandmother, was a chiropractor. Coral Sr. was a chiropractor. My mother and father were chiropractors. And as a child, we didn't take vacations. We went to chiropractic conventions. And I'd get dragged up to Davenport, Iowa every August to sit in a tent. And have you ever been in a tent in Davenport, Iowa in August? It's hot. They forced me to sit on the front row of a folding chair in a tent. They would hand us these fans, and on one side it said, keep smiling, and on the other side it said Future Farmers of America. So apparently they were a sponsor. But I would have to, as a child of 6, 7 years old, I would have to sit in that under that tent, in that folding chair, my grandmother on one side, my great-grandmother on the other relatives spread around. They forced me to sit and to listen to J. Clay Thompson. They forced me to listen to Clarence Gonstead. And I still remember the stench of B.J. Palmer's cigar. And he scared me, you see. And I resented that as a child, but today I wouldn't trade those memories for anything.
No.
So, to respond to your question directly, Dr. Sylva Ashworth, great-grandmother, and daughter Ruth, grandmother, were active in what was called then the National Chiropractic Association, the NCA, that later became the ICA, today's ICA. I'm sorry, let me restate that. The NCA has become today's ACA, American Chiropractic Association. But my father, grandfather, and my mother were close to B.J. Palmer and the ICA movement. I would go to a Thanksgiving dinner surrounded by my relatives. We couldn't get past the salad, and they'd be talking about the personalities in the ACA and in the ICA. And so I grew up seeing both sides and both dynamics and seeing the common denominators. One common denominator throughout that Thanksgiving weekend, I'd get adjusted by multiple relatives, and they all adjusted me the same, assessed me and adjusted me. So I saw the uniformity. And when I had the opportunity, when the board positioned me to step into leadership of this institution, one of the first things I did was to start a student ACA and a student ICA. Cleveland had historically been a student ICA college. It had been Palmer, it had been Logan at that time, and there were others. And so I just started inviting the leadership of both ACA and ICA onto campus to be part of homecoming, and saw the benefit and seeing the more commonality within the profession than some of the uniqueness and diversity. So my focus has been on, in fact, we have a student ACA and a student ICA and an American Black Chiropractors Association. And we pay for their membership, for their student membership. Why? Because we want them to be informed of the issues. We want them to become activists so they too can go out and be leaders in this profession. So it's really about leadership. And how are you going to understand the thinking of the competition or the other side or the other vision if you're not involved in getting to know them? So that's worked well for us. Our focus, we have a very active ACA and ICA chapter and an active American Black Chiropractors Association. In fact, this next centennial year, the American Black Chiropractors Association is going to be hosting their annual conference on our campus here.
Great.
And the ACA and the ICA, they will be involved too. And I'm hopeful maybe the Motion Palpation Institute would be involved in that centennial celebration.
Absolutely.
Yeah, that'd be amazing.
Absolutely.
So how do you play the political game, Dr. Cleveland? So obviously you have different philosophies and different ideas, and we always say chiropractic's a little bit like the Wild Wild West, and that's a good thing because it's kind of open-ended a little bit. You can kind of choose your own adventure and what you want to go into. How do you manage all those different thoughts, and how do you allow your students to dabble in different things and still keep control of everything?
Well, it goes back to the focus. It goes back to the premise. And beginning in the first trimester, and you'll remember this, we work on what would be your statement about the identity of chiropractic. And it's not that all students agree with me or all alums, but we begin by describing chiropractors. The doctor of chiropractic is a healthcare professional for the diagnosis, care, and prevention for functional disorders of the spine and other parts of the musculoskeletal system. And that the focus of chiropractic is on maintaining proper spinal function, its relationship to the nervous system, and the patient's good health. Now, if we just stop there, that's a pretty common denominator within chiropractic thinking. So we build our curriculum around that focus. Sure, we teach nutrition, we teach acupuncture, adjunctive therapies. Not that that's not part of chiropractic, but stop 10 people on the street and say, what's a chiropractor? Or why did you go to a chiropractor? It's going to be spine focused. So let's start there. And then you know this, if you look at the evidence today, someone asked the question, why so much cultural authority in this profession today? Well, there are multiple reasons, and I like to speak to at least 5. And when I say cultural authority, I'm talking about chiropractic officially with the Olympics. I'm talking about chiropractic on all NFL teams, on most baseball teams, and everywhere else. It goes back to, I think, 5 dynamics. The first 3 are reflected in Withington's triple aim. You may or may not have heard the concept. It was proposed in 2008 in a congressional discussion, and Withington and his colleagues are epidemiologists, and so they look at the origins and the progression of disease or afflictions in healthcare. And his advice to Congress at that time is, if you want to effectively impact healthcare in this country, then make your choices based on the simultaneous pursuit of 3 dynamics. Is the procedure effective? Do you have evidence that the procedure is effective? Do you have evidence that the procedure saves money? And do you have evidence that the consumer is satisfied? So effectiveness, cost effectiveness, and consumer satisfaction. And if you look from Gallup poll to all of these other procedures, patients love their chiropractor.
Oh, for sure.
So we meet those 3 aims. And if you look at the, it's interesting, in spring of 2017, from February to May, in February of 2017, the American College of Physicians came forward for pain management, first look to non-pharmacological procedure, and among those procedures they outlined chiropractic care. Then you had the Page study in the Journal of Medical Association the month after that. Same message for pain management, include non-pharmacological approaches, and then chiropractic is listed there, as is osteopathic manipulation and acupuncture. Even on the 1st of May, our country's Food and Drug Administration comes forward for pain management. They had 2 things, chiropractic and acupuncture. So now all of a sudden you have clinical medicine establishing a guideline that includes a non-pain approach. That's a tremendous to pain management. That's a tremendous opportunity. Not that chiropractic is only good in its effect in back pain, neck pain, and migraine and headache. But if you look at that concept alone of our role as part of the guidelines, that's a tremendous opportunity for this profession to move forward. And the research is there. Fourth dynamic, triple aim the first three. The fourth dynamic moving this profession forward is the tragedy of the addiction to prescribed drugs. I often step back and think, why in that spring of 2017 did those three, there are actually 5 studies that come forward with those conclusions? It's because healthcare is backed into a corner. They have to find another approach to address the tragedy of this addiction. And we're part of that solution. The fifth dynamic moving the profession forward is the aging baby boomer. Have you ever seen one? Don't point. But they were born between 1946 and 1964. There's a whole lot of them. They drove social change in the 60s and the 70s. And AARP says that a baby boomer turns 60, 10,000 baby boomers turn 65 every day in America. And you know, my image of old age, when I was some of these students' ages up here in our assembly hall today, my image of old age was 65 years old on the front porch in a rocking chair. Today, the image of old age, 85 years old, on a Carnival singles cruise. There are new attitudes about aging. And what profession is better positioned to usher those aging boomers into their golden years? I mean, they're starting new careers, they're volunteering, they're teaching. So those 5 alone give this profession a tremendous opportunity to move forward and to fill a need. And we have to prepare our graduates to speak that language, to be able to communicate in that multidisciplinary setting. Gallup poll, 2016, the Palmer Gallup poll, said that in the past 12 months, 14% of the population saw doctors of chiropractic. Well, the strategy is, how do we get beyond that 14%? Some might say that number is generous, but that's what Gallup said in their survey. How do we get beyond that? What we're seeing, and you know this too, is more within medicine, specifically within the orthopedic division. We're seeing chiropractors step in to be the first point of contact, to assess, to screen that patient. Most of those patients, as I understand, can be managed conservatively with chiropractic care, but for those very few that may need some intervention by an orthopedist. Why do I cite that? You know this is the case. I'm a former clinic director here, Jeff Miller, Dr. Jeff Miller. You might know him.
Yeah,
he's at the University of Missouri, Columbia Medical School in their orthopedic division. He's there with another chiropractor. I lectured at MU 2 or 3 years back, and I toured his facility, and it's impressive. And I said, well, Dr. Jeff, what's a day like for you? He said, I practice, he said, patients come in, they're referred to me from other health providers. I assess them. 90% of them I manage myself conservatively through chiropractic care. The rest I then refer for additional evaluation by either pain intervention, pain management, or by orthopedist. And he said, you know, he said the orthopedic surgeon will tell you that out of 100 patients, they have to screen 100 patients to come away from to find 8 to 12 that may be candidates for surgical procedure. So when you think of the opportunity, and if you look at what's occurring in these different venues where doctors of chiropractic are working in cooperation with a multidisciplinary relationship, that's an opportunity to go beyond the 14% and get access to a large chunk of the other. So you ask about the future. We have to, you know, most chiropractors will continue to want the independence of going into their own practice and being independent. You know that's the case. But from the VA to to University of Missouri Med School in Columbia in the orthopedic, we have opportunities to prepare our graduates to step into those multidisciplinary relationships, to deal with the functional disorders of the spine, and help identify where are the structural ones or pathological ones that may be candidates for surgical care.
Right.
Did you hear that? University of Missouri, just making sure you I'm a grad of University of Missouri.
Well, I'm a grad from Kansas City.
Okay. Yeah, there you go.
He gets it. Okay, so great answer. So what about Dr. Cleveland? So what about this new rise in private state universities? Rumors that they're starting their own chiropractic programs. They're going to be, maybe the University of Missouri in the future would be having its own chiropractic division. Do you feel like that helps the profession? Do you feel like it's a mix? How does Cleveland or these other private schools stay at the forefront?
So if you're asking the question, what would be my position about establishing a chiropractic program in a state-supported university? It would have my full support. It would have my full support. I'd be happy to share our curriculum, our faculty handbooks, our employee handbooks, because when you think about it, the upside of public education, and there's some landmines that would have to be navigated, is it's wrong that there is no state funding for chiropractic education. In other words, the buildings you see here and the equipment in the classroom, that's largely funded, and even the research we do is funded by student tuition dollars, on the backs of student tuition. I'd say 85 to 90% of our operation is driven by student tuition. That's wrong. You go to a state university, the medical school, these are old statistics, the University of Kansas Medical School, as it was reported to me by their dean many years back, 3% of their budget comes from tuition. The remainder comes from other sources to educate those students, and that's wrong. And I would support that 100%. Now, what we do know from our colleagues that are part of Bridgeport University, for example, in the Bridgeport College of Chiropractic, one of the challenges becomes that they're one program among others, and so there's the issue of competing for the resources, and if they need money to go to an ACC RAC meeting, and if it's not budgeted some months back, they don't have those funds. Whereas I think in a private college, as I know is the case in Cleveland, we have far more flexibility. So the intent of that is good. It would be important, though, that if a state-supported institution is going to have a chiropractic program, that they bring in the leadership that can keep the core elements of the principles and practice of chiropractic as paramount within their program. I had some experience with one of the European schools that opened a chiropractic program in a school that was also dominated by physical therapy. And the challenge as we sit back and look is, does the chiropractic principle and concept of the relationship between spinal function and the nervous system and how that contributes to health, my concern is, is that being watered down and being viewed as a form of chiropractic being viewed as a form of physical therapy, if you understand the concept. We've seen some evidence of that, not in the United States, but outside the United States with some of our European institutions.
Well, how would you reconcile then if you went to University of Missouri, let's say that you were on a full ride scholarship, so basically your chiropractic education would be free, versus like now at like Cleveland, like how do you, what would have to change there, because the average student coming out, I think, is $200,000 in debt. So like, how do you get around those financial things? If we're talking about maybe like a friendly competition between a state university and a private chiropractic college, how do you do that?
Well, you have that dynamic now from private education versus public education. I am one of 19 independent private colleges here in the state of Kansas, the Kansas Independent College Association. And the Regent-supported colleges, the state-supported colleges, obviously they get the state support, and we're outside that on most of the issues we deal with in the state. But you see, an advantage to a private college is, and I'm not speaking chiropractic, I'm talking about the Kansas State private colleges, is the number of graduates. They graduate sooner, and they graduate with, while they may have more debt, they may get more scholarships to defer that debt, and they seem to be more satisfied with a personalized approach. They're not just one of 100 students in a chemistry class, for example, and that's the benefit of private education, a more personalized approach, attention to detail, and you're more of a name than a number.
Sure.
And so those are the benefits of private education versus, and our default rates are lower in the Kansas private colleges compared to the public supported college. Now that's just within the state of Kansas. I can't speak outside that.
Across the board in chiropractic now, people speak of, so tuition's going up. Like I said, the number that everyone's saying is on average $200,000. What the average chiropractor actually is going down because of managed care. How do you reconcile that? It's almost like an inverse relationship.
Trying to maintain the cost of tuition as low as possible continues to be an issue for all of the chiropractic colleges.
Right.
Here now, 2 years in a row, Cleveland has elected not to raise tuition, to try to minimize that. The cost of education is expensive. However, if you take the cost, not counting living expenses, but if you take the cost of tuition for just the educational experience here at Cleveland, it's not a whole lot higher than a bachelor's degree tuition at private colleges at Rockhurst College, if you know, and that gives you a bachelor's degree to enter the door, whereas a doctor of chiropractic, you know the benefits of that. So it's a balance. We're concerned about that. Costs go up. You know that's the case in your practices too. Continues to be a challenge.
Yep.
Yep, absolutely. You had mentioned something that kind of triggered a memory for me too. Speaking of memory, you have this insane ability to remember people's names. And so one of the cool things, the story I always tell Brett that always amazes him, is in the first day of school, you basically have every single incoming student's name memorized. How do you do that? Were you just blessed with a good memory, or do you have a practice that helps you with your memory, or...
We want the real answer.
The real answer.
Taylor, how could I forget you?
Exactly.
It's real simple. It's one name at a time.
Yeah.
You know? And it's association, and that's what all memory is. You know, it's being able to quickly associate.
Tag it to something else, to maybe another Taylor.
That's one system. You know,
Yeah, absolutely. Well, one of the things that I'm always...
Way to not answer the question.
Yeah.
And it's good genes, too.
Yeah, good genes. But I just appreciate Dr. Cleveland. You know, I really hadn't had I toured Cleveland one time and I decided it's close to home. This is where I want to go. I really didn't look elsewhere. And being around other campuses with Brett and stuff, you're on campus from day one and you were on campus the whole way through. And so I personally appreciate that because you have a personalized touch to the university, and I think that is one thing that really separates Cleveland. It's a personal touch, and like you were talking about, a smaller private school, you do feel a part of something. So I just want to commend you for that.
It feels like family, kind of. Yeah,
exactly. So anyway, that kind of I really appreciate that. Brett, you got any closing questions or anything like that for Dr. Cleveland?
No. Since we're here for the MPI, how did you meet Len? Like, how did that relationship all start?
We have a graduate, his name was Paul Hooper, Dr. Paul Hooper. And Dr. Hooper was on our faculty here. And Dr. Hooper attended Len Fay's seminars. And he said, you really got to go hear this guy. And I kept putting it off and putting it off. And so finally, I went to a Len Fay seminar. And what Len Fay did for me is when he was walking down the 5-component model of subluxation complex, that made sense. And then when he coupled that with the functional assessment, that even made more sense. And what I've seen over the years, and we've tried to address this in Cleveland's curriculum in a very strategic way, is so many times students will go to a chiropractic college and they're given this technique and that technique and this technique and that technique, one right after the other. And and I see a deficit, and we still have some homework to do, I think, is in a student's or graduate's commitment to appropriate assessment of the indications for the adjustment, and then give that thrust based on the biomechanics and the indications of that assessment, and then come back and recheck, if you follow where I'm going with that.
Yeah.
Len Fay answered that question
did,
for
yeah.
me.
Yeah, absolutely.
And he did so very well. And he and I were both lecturing at a conference in Beijing, China. It was 1985. It was with the World Federation of Chiropractic. You're familiar with the World
Yeah, of
Federation of Chiropractic. And he and I were both on the program, and we would eat lunches together. And I knew about his 1977 tapes. And I said, Lynn, could we do this? If I bring you to Cleveland and you come into our studio, would you allow me to redo those 1977 tapes in current technology? And my goal is, I know that it's a revenue source for you, and I will honor that. But we will do the video and the scripting and the editing if every student, Cleveland student, can have a copy of that video. And then he was a faculty member at our Cleveland, Los Angeles campus, and I would be there every week, and I get an adjustment from Lynn Fay. And so I've experienced his skill firsthand. It's when you think about how the mindset of chiropractic is evolving to look at spinal dysfunction from a dysfunctional standpoint as opposed to a static positional disrelationship. Not to say there may not be conditions where there's the static disrelationship, but it just makes sense to proceed with the functional assessment. I was so proud because when I went to be assessed by him, he starts going through that screen, MPI screen, and then proceeds to adjust me, and it snap, crackles, and pops, and I was impressed. And then he sets me back up, and he's rechecking that improved range of motion, and that's what I want every Cleveland graduate to be able to do. Not that there's not value to the other techniques.
Right.
And our approach to technique, and we used to teach toggle recoil as the first technique, and then move to Gonstead technique, and then move to diversified technique, and then let students go into a variety of the more focused techniques and specialized techniques. And we just, about 20 years ago, turned around and said, look, we're going to create a Cleveland comprehensive technique system. Technique 1 is your static palpation. Technique 2 in the second trimester, and you'll remember this is your motion palpation.
Sure.
Technique 3 is then you proceed to adjust in the lumbar and the pelvic region, and then technique 4 becomes then cervicals and thoracics, and then technique 5, extremity adjustments, and then integrated technique. What we're finding by taking that approach and building it around the functional model, it's like this. Rather than shotgunning all of these different philosophies and technique, and you can learn those at the end if you want to take Gonstead in the purest form or SOT. You can take that after you've been through Cleveland Comprehensive. But what we're finding, it's kind of like this. It's like learning algebra very well before you take trigonometry and geometry. Does that make sense?
Complete.
And that's what this functional model does. And so we share the same goals.
The second part of that question was, you smelled the cigar smoke of B.J. Palmer. I want to know who else had their hands on you. So, I mean, over the years, like of the big names, who is
the greats in
who are the
chiropractic.
greats that you've been around that have worked on you, that you've been influenced by?
My great-grandmother, my grandmother, my grandfather, my mother.
Your whole family.
They had quite an influence on me, without a doubt. And I knew Bill Blair with upper cervical technique.
Okay.
And I sat in his lectures. In fact, just before I started a chiropractic program, I went on a tour that my parents were lecturing on, sponsored by the ICA, and there were a series of lectures. Gonstead was, so I'm on a tour bus in Italy with Gonstead and his wife, going from town to
That's
town,
amazing.
and with William Blair for the Blair technique. Gillet, I met him. He was Belgian, and got a chance to sit in her. They never adjusted me, but I got to sit in their lectures, and that was really important
Yeah,
to me.
what an experience.
And one of my goals of many, and it's aspirational, is that every American know and understand and value chiropractic care, just like they may take benefit of dentistry. Growing up as a son and grandson of a chiropractor, I realized I was different growing up. Short story, a little girl up the street I was probably in 7th grade. She was in 8th grade. Her name was Phyllis. And on Saturday mornings, we would play baseball in the neighborhood with friends. And as a young kid, I'd go up there. I had a mitt, and she had a ball and a bat. We were about ready to meet up, and I was waiting for her to finish up breakfast. And she then came out, plopped down on the step next to me where I was sitting on the sidewalk, and said, "Carl, my father says your father's bad. My father says your dad's a quack." I never heard the word quack in that context. Ducks made the noise. I didn't understand. And it wasn't very long, the kids in the neighborhood, you know how kids will taunt one another and tease one another? I'd be up to bat, ready to swing, and they'd say, "Go, Quackter C. Go, Quackter C." That was my nickname all the way through high school from my friends, the C. And why? Because they didn't understand what chiropractic was, and they didn't value it. And my grandchildren aren't going to hear words of disrespect about chiropractic today. And I go to my class reunion here, 50th class reunion. And I was so hopeful to see Phyllis because I wanted to talk to her. I was so hopeful to see Bobby Zajic and Ovi Glenn, my buddies that called me Quackter C when I was up ready to swing. And I got there early, and I'm looking at the registration list at the table. You know, you haven't been to a 50th reunion yet, but you'll be there someday.
Hopefully.
And I didn't see their names as registered. And I thought, well, Phyllis probably has a different name because she would have gotten married. And so I couldn't wait to get in and work the crowd. I told my wife, Elizabeth, "I'm sorry, honey, but I need to find some of my colleagues that I grew up with." None of them were there. I just searched that room. Bobby Zajic wasn't there. Phyllis Johnson wasn't there. And if they would have been there, I would have gone up to Bobby Zajic. And I would have said, "Bobby," I would have shaken his hand. "Thank you for calling me Quackter C." If Phyllis would have been there, I would have given her the biggest hug and said, "Phyllis, thank you for calling my father a quack." I would thank them for lighting the fire in my belly to do all I can to bring the image of this profession in line with the reality of today's practice.
Right.
We've talked about those pioneers. There were many of them. They lit a torch, and they've passed this torch to the next generation, and your responsibility is to help me sustain that flame.
Let's do it.
That's awesome.
Yeah. Thank you so much.
Great.
Yeah,
What a perfect ending, Dr. Cleveland. That is awesome. So, guys, I hope you appreciate the little bit of history. And Cleveland is a special place. There's no question. I mean, Brett and I, we always have like an internal ranking system of colleges because we get asked all the time, where should I send? Where should I go? Where should I go? And Cleveland is every single year. It's getting better and better and better, which is hard to find in education.
Well,
so congratulations, you're a main player in that, and so thank you for letting us in the space. And
I'm surrounded by a good team.
Absolutely,
and we're looking for additional clinic leadership and clinicians. So
he keeps asking me. I keep telling Brad as soon as he uproots Winchester Spine Sport from Troy, it required divorce first, but
it can be amicable.
You never know. We never know. Well, awesome guys. Keep assessing your patients, keep asking questions, and keep promoting chiropractic for what it is. An amazing profession and an amazing way for our patients to feel better and to be better, right?
Thank you.
Awesome. All right. Good luck on Monday. Have a great day, guys. I hope you enjoyed this episode of the Gestalt Education Show. If you liked it, share it, subscribe to it, send it to your friends, send it to someone that needs to hear this message. We really want everyone to be able to tune in and get the best clinical advice that they can, which we're hoping that we're giving to you with these special guests. So if you have any questions, please feel free to reach out to us, or if you have any suggestions on upcoming conversations, let us know. For a list of our upcoming courses, we're adding them all the dang time. So go to gestaltedu.com, click on courses, and they'll all be right there for you. All right, have a good day.